What is surveillance, and how is it used to improve the health of Canadians? The Oxford English Dictionary defines surveillance as close observation, especially of a suspected spy or criminal. That's not the kind of surveillance we're talking about. Rather, we're talking about public health surveillance, described by the World Health Organization as the continuous, systematic collection, analysis, and interpretation of health-related data needed for the planning, implementation, and evaluation of public health practice. This is the kind of surveillance we use to better understand asthma. Let's consider how we might perform surveillance for asthma in a small population of 10 people. First, we need a working definition of asthma that can be applied systematically. Let's use the Global Initiative for Asthma criteria for diagnosing asthma. We check whether each individual has asthma symptoms, we check their health history and see if it's consistent with asthma, and we perform lung function tests. We analyze our data and send our report off to relevant stakeholders. Because surveillance should be continuous, we come back every year to see how rates of asthma are changing in this population. But what do you do when you want to know about asthma in a larger population, in a community, city, health region, state or province, country, or in the whole world? In those cases, you might want a surveillance system that is passive, that doesn't require going into the population and actively diagnosing and assessing asthma. Here in Ontario, Canada, our provincial asthma surveillance system is called the Ontario Asthma Surveillance Information System, OASIS. It monitors asthma in Ontario's population of 13 million individuals. Rather than directly studying the health of individuals, we analyze data from people's encounters with the Ontario healthcare system. We systematically apply a definition of asthma across all these data and can then count the number of people who have asthma year after year. We analyze these data and provide information to stakeholders and the public on our website. You can find out more information about Ontario provincial asthma surveillance there. The impact that surveillance has on Canadians is widespread. Surveillance tells us how many Canadians have asthma, who is at risk at what points in their lives, and where is asthma most common. It helps us to plan for the future burden of the disease, to evaluate the impact of programs to treat or prevent the disease, to calculate the costs associated with asthma, and to generate important questions for future research. Ultimately, the goal of asthma surveillance is to reduce illness and mortality and thus contribute to a healthier Canada for all.